what is your name and where do you work? And what is your commitment to community health?
Okay, so my name is Viola. I'm currently living and working in Spain, but I've been working in community health over the past 10 years, roughly. In between Latin American work, I've been working in Nicaragua and in Mexico in community projects, and that's where I came about to learn about community health and especially the social determinants of health which affect communities and the people who live there. And then I moved back to Europe and I studied public health. I did a EPH, the European Public Health Master, and then a PhD in public health at the University of Sheffield. And my PhD was based on evaluation of community health projects, one in Sheffield in the UK and the other one in Valencia in Spain. Yep. So from then I kept working on community health, which is a great passion for me, and especially taking the participatory approaches, which I think are needed when working with communities.
Yeah. Can you say a little bit where you live, how community health is organized?
So in Spain, there's the ways the community health is organized. It goes mainly through working with local authorities, through the National Strategy for Health Promotion and Prevention suggests that local authorities start a sort of intersectoral group of people working together for community health in each locality. So those cities that are interested in taking up this opportunity, they can start this intersectoral group of people, which is mainly based with health professionals, people from local organization, also individuals that would like to come along, and people from the municipalities. And they all sat down at the same table to start working in community health. So one of the first steps is to do a community health needs assessment, including taking the assets perspective, so looking at resources and things that are good for the people living there. And then from then, they build up projects to take care of the needs that were identified, always taking this intersectoral approach.
Yeah, okay, thank you. And my third question is, what have you learned over the last couple of years in the context of community health and building resilience?
So I think one of the biggest learning for me that is about engaging, as I was saying before, engaging with people and communities, because otherwise there's a lot of efforts that is being put in from the states or from institution, from organization. But if you don't have the input from the community, all these efforts are kind of vain. They don't really get to the point where they should be getting. And one of the main reasons, I guess, is because you need to engage with people and ask to them and then work with them about things that are important to them and not what you think your predetermined version of what's wrong or what's needed that comes along. Sometimes it's not exactly the same one as the one for the people. So I think you need to sit down and have this shared dialogue where everyone is respected and everyone is listened to, and then find a common solution and a common approach to build proposals and to build resilient communities.
Yeah, and can you give an example of that?
Yeah, so I've been working in a variety of projects over the past 2 years. And one of the last projects I'm working on is a really taken on board the participatory approach, and the results are amazing. We started with a group of 30 people, and we've been starting the project just before the pandemic started. So it was a bit of a rough time for doing community engagement workshop, but we decided to take it on, and the people were very excited. We designed together, they designed their own survey about the community health needs and assets that they wanted to know about their area. And after 2 years, pretty much of working on the survey, then they got a training on focus group, and now they're doing the focus group on their own. And there's still 30 people involved, and they're still very committed. Wow. And they're still very excited about it.
Yeah, thank you. My next question is what the role is of community health workers in improving resilience in communities in times of crisis.
I think one of the key roles would be that the role of a facilitator or a partner, if you want, in working together with the community. But more than anything, it's about listening what you need, and then, I'm here to provide the support that you need. This is my part of the expertise. Like, I know the skills, I know methods, I know how to access funds, for instance. But then the other side of the skills and the expertise is the community and their own needs, voices, interest, and all the skills that they have, all the richness that there is there. So I think it's a combination of this, finding a balance in between these two set of skills, so to speak. That is the key to make it work.
Yeah.
And when I'm talking about community, I'm also talking about the other sector involved in community work, not just the people. I mean, also the municipalities, as I was saying before, or local organization. I think they're all part of the community. And the role of an external community health practitioner is, for me, is like to provide the skills and the support that they need to make it work for them.
Yeah. Okay. And my final question is, you as an experienced professional, what advice can you give to the new generation of community health workers?
I think I probably repeat myself, but I say be ready to listen. I think that's one of the keys. Sometimes we tend to, and I myself have done the same before, learning how to work properly with communities. It's just like, I have a set of idea, this is what I want to do, and I'm going to try to do it. And I think now my approach is the other way around. Like, I have a set of skills and I'd like to know what you want to do and see how we can work together on whatever you want to do.
And how can you maintain that? I mean, how can you give people hope? You know, what is your
people? You mean other health community health practitioner, you mean, or workers?
Yeah, or the people you work with. I mean, the example you gave, you know, you started in 2019, you still have the group together. I mean, apart from your listening abilities that you acquired, what else?
I think just be there and be supportive with all that they need. I guess there is no other way to do it, and be patient, because sometimes the time scale is not exactly as you expected. Well, most of the time is never as you expected, but that's part of the beauty of it, because so many other things come along and they enrich the process, and I think you need to be ready to play with it as well. And so play along and be there.
Okay, thank you.
Okay, thank you.